So welcome guys, I have an absolutely amazing episode to bring you today. Today I talk to Matt, who's a lifelong hiker, a physiotherapist and a knee specialist. And we dive into some really absolutely amazing information regarding knees while hiking. So we talk about overuse injuries, using knee braces, ACL reconstructions, the ITB ban, and a whole bunch of other things. So if you've ever dealt with any knee issues on the trail, or you know someone who has, then this podcast is going to be incredibly valuable for you. So buckle up, get ready, and I hope you enjoy. Hey, my name is Rowan Smith and I want to welcome you to the Training for Trekking podcast. Now this is the world's very first podcast which is entirely dedicated to helping you train, prepare and conquer your upcoming hike, trek or mountain adventure. So once a week I'm going to be giving you quality and practical information on the subjects of physical preparation for trekking, dealing with altitude and nutrition on the trail, so you can know everything you need to be doing to have the best chance of a safe, enjoyable and successful adventure. So now you know what you're in for. Let's get into today's episode. Welcome, Matt. Thanks for coming on the show. So really stoked to pick your brains a little bit today. So to start with, I just want for the audience who obviously don't know about you, could you just tell us a little bit about what you do and then also what brought you to specialize in knees in particular?
Yeah, certainly. So my name's Matt. I studied physio back in 2013, I think I finished, 2012, 2013. And I have been working at Ryan Family Physio for about 4 years now. And I've come to specialise in knees because I have a big interest in being outdoors, getting into hiking, walking, running, cycling, any of the above. And I know a lot of people, their biggest issue with getting into exercise is knees. And I'm really about empowering people to get into outdoor activity, and I keep seeing a recurring theme of knees being the big issue, stopping people from getting into what they want to do. So I thought I'm in the position as a physio where I can help people and bless people, and I thought what better way to do that than by allowing them to be able to do what they want to do.
Yeah, fantastic. I absolutely love that because I know for myself, like just working with specifically hikers and trekkers, like the majority of people coming to see me do have the knee pain in one way or another. And, it is a really big thing holding people back. So that's really great to hear. So, well, maybe digging into hikers and trekkers right now, seeing it is such a common issue. Do you mind giving your point of view why this is such a common issue? And then particularly seeing, hiking and trekking is considered more or less a low impact sport compared to other things?
Yeah, certainly. So I'd probably put hiking and trekking as probably low to moderate impact. Like some treks are just on rocks and uneven and it can be a moderate impact, whereas other treks are more sort of along flat ground, whether up or downhill, which is more of a low impact. But I don't see why the impact is the issue, because joints need impact to be able to grow and to nourish and to become stronger. So when we talk about impact, it's only too much impact too soon that causes an issue. It's not the impact itself, which I think is an important distinction to make. And I think a lot of people get knee pain when hiking because the knee is a bit of a joint of consequence. Your hips are a really, really strong joint. Your ankles are a strong joint, and they're both flexible joints. But the knee can only really bend two ways, forwards and backwards. So if the hips are moving uncontrolled, or if the ankle, you've got flat feet and you're rolling in, or if you've unstable ankles and you're rolling all the time, you actually walk to support those joints, and your knees are the ones in the middle that seem to take the brunt of the impact, I'd say, Rowan.
Yeah, all right, fantastic. Like that's really interesting to talk about. Yeah, it definitely needs the impact, because as you said, that's a really important point to make. So yeah, that's great. So moving forward, I think like as a really, really massive generalization, like knee pain on the trail is often referred to as hiker's knee. So would you mind explaining a little bit more detail what that actually is?
Yeah, so hiker's knee is also used as jumper's knee or runner's knee. It's basically repetitive use of the front of the knee in particular. It relates around the little bone at the front of the knee called the patella, where there's a lot of connective tissue where the quads go into the patella and into the shin. And I guess hiker's knee is a way of describing the most common type of pain people get while they're hiking, which is through the front of the knee. And I would describe hiker's knee as overuse generally. I mean, if you're in pain, it's an overuse to some degree. An overuse injury of the front of the kneecap and patella and the connective tissues around there. And yeah, I think that's really all that needs to be described about the hiker's knee.
Yeah, okay, fair enough. And then maybe for some of the listeners, what is an overuse injury as a generalization?
So everyone's body has a certain tolerance to activity, a certain tolerance to exercise. So overuse is anything exceeding your body's ability to cope and manage. So someone that sits on the couch day in, day out, and then they get into hiking and they might only do a 3 or 4K hike. But if your tolerance is really low, you can cause an overuse injury doing that. Whereas other people who might just be generally more active or even better, actively training for a hike, their tolerance might be something like 20 or 30 kilometers, or the extreme cases, it might be hundreds of kilometers. They might have trained so well, they have such a good tolerance that they're not going to get that overuse injury. But an overuse injury is when your force you put through the joint exceeds your body's ability to maintain and cope with that. And what happens is you get little tears in the tendon and little tears in the muscle. And the body's natural way of healing that is causing inflammation. The inflammation isn't a bad thing. The inflammation just means your body's telling you too much. Stop, rest, let it heal, and then you can go out and go again.
All right. Yeah, perfect. Well, that I know just even if we stop the podcast right there, that pure explanation would help so many people out. So that's a brilliant start for us right now. So I'm stoked already. So moving forwards, if someone is suffering from hiker's knee or an overuse knee pain on the trail, what are some sort of general recommendations you could give them?
So if you're suffering from hiker's knee on the trail, it's usually because you're either at the top of the mountain and you're looking down and you're worried about how you're going to get back down without hurting your knee, or you're away from civilization a little bit, you're out camping and you can't get back to town easily, and you need a way of getting back down the mountain and looking after yourself. So the first thing, I guess, is minimizing the load you're putting through the knee. So if you're hiking in with a backpack on, unloading some of what you can. Don't tip out all your water at the top. That's probably not a good idea, but probably the biggest thing is to shift the contents in your bag around so that you're not having all the weight at the top. You've got the weight around your hips and you don't have your bag unevenly weighted. So just mitigating some of the risks with that, or if you have some good friends up there, give them a little bit of your weight if they're managing okay. And then probably the second thing is as well, realize what is causing your issue. So you might only have issues walking downhill instead of uphill. In that case, you only just need to be careful how you're loading going down the hill. People tend to go sideways when they're going down hills because it's steep and they're worried about putting all the load through their knee. But sometimes if you're walking down a steep hill and you're twisting as you're going down, you might actually be hurting the knee by doing that. So sometimes it's safer just to take it a little bit slower and just walk as you normally would.
Okay. Yeah, that's really good to know. So I know occasionally when I've sort of had, when I've been on the trail and my missus had issues with her knees, we get her to walk backwards, like if there's a relatively non-uneven section of the trail. What's that doing to her? Because it seems to relieve a little bit of the pain.
Yeah, so if it's safe to, and you're going down a decline and you're getting knee pain, walking backwards takes the load off your quadriceps and puts it onto your calf muscles. So that's effectively unloading your patellar tendon, taking away all that pressure. So if you can do that for a period of time, it will take away that hiker's knee sort of load going through the front of your knee. So that's what it's doing, Rowan.
Yeah, too easy. And as long as you don't fall over, obviously, but
that's
there
right.
You go. So, all right. So when, I spend a bit of time lurking on these internet forums and hiking and trekking forums online, and, whenever the question of knee pain on the trail or whether you're hiking or trekking comes up, you always see people piping up with answers of like, use a knee brace, tape up your knees, get some orthotics, stuff that might have worked for them, but it's, they're obviously not a professional opinion. So to start with, what's your opinion on these types of things? And when, as a generalization, might they be appropriate or even not appropriate?
Yeah, so I guess with braces, there's horses for courses. There's a brace for every different thing that can go wrong with your knee just about. And that's because there's lots of things that can go wrong with the knee. So some people might need a brace for one injury they have, and it's great for them. But if you give that brace to someone else, it can be harmful or do nothing for them as well. So I would say with braces, there is a time and a place for them. With braces, I'd say if you have a gross instability of the knee, which I mean there's ligaments that should be supporting the knee that aren't there, that's when a brace is important. So, for example, if someone's had MCL rupture, waiting for surgery, they need a rigid brace stopping that knee side-to-side movement. If they've had previous patella dislocations, it means there's a gross instability of the patella and you need some support for the front of the knee in that case. But I would say probably for about 90 to 95% of people, no brace is really necessary forever. Sometimes a brace is good for a short period of time to get you back on track, back on the course, unload the painful area so you can start training again. But anyone using a brace for a long period of time, they're really just putting a band-aid on an arterial spurt, I reckon, Rowan. It's like they're trying to put out the fire, but not really getting to the source of what's causing the issue. So I would say with braces, probably get a professional opinion on what is going wrong with your knee first, or even just look around at doing different exercises. I know you've got a really great exercise program that people can go through. Give that a go. And if you're still getting knee pain, look at seeing a professional for a bit of diagnosis on what brace might help for a short period of time.
All right, guys, so very, very short interruption into this absolutely amazing episode. If you do want to get your hands on that hiker's knee prevention guide that Matt just mentioned, please just see the show notes. You can download it below. Has all the information he's talking about, plus a free 12-week training program to help you prevent knee pain while on the trail. So let's get back into it. Here we go. Yeah, awesome. And I love that that analogy, a band-aid over an arterial spurt. I'm definitely going to steal that in the future, I think.
Good one.
So all right. So we've covered a bit of hiker's knee. We covered a bit of equipment. I reckon the next thing we want to move on from the overuse injuries. And I know a lot of the people listening to this and a lot of people who I've dealt with in the past are coming back from more like acute injuries such as ACL tears. And I know, these types of things are way, way too complex to completely dissect in a short amount of time. But in sort of general terms, if someone did have an ACL reconstruction, what are some things that would be essential in their return to trail? And what might be some common mistakes some people might be making in this process?
Yeah, so this actually hits close to home. My brother actually injured his ACL probably about a month ago, and he's just had his reconstruction surgery. So on that, probably the first piece of advice I'd give is not getting back into it too quickly. There is a period of time where your body does actually need to recover and take its time to let everything heal properly. But on the flip side of that, the other trap people can get into is not doing enough. So once things are healed, if you don't do enough, you're not getting the load, you're not getting the impact through the joint to allow things to actually heal and strengthen and build and grow and recover. So they're probably the two biggest mistakes to start with. But I would guess most people asking this question about what can I do after my ACL surgery have probably gone through that initial stage of everything being painful and that slow and arduous task of rehab and strengthening. And they're now at the point where they want to get back into exercise and get back on the trail. Is that right, Rowan?
Yeah, that's about it.
So I would say with getting back on the trail, you really just need to remember that you've gone from a certain tolerance level and then your tolerance level's been thrown out the window and you have to build that back up again. And you're in a funny position where you've probably actually got one knee that's managing very well and one knee that has a much lower tolerance now. And you should, I think, when you're getting back into your rehab or getting back at your tolerance for hiking, focus on the knee that you've had the ACL rupture in, because it's got the lower tolerance. So, even if your right knee is going for days, you shouldn't push it if your left knee is still lagging behind. You should use your sore knee as the guide of how far you can go. So if you're getting excess swelling the day after or the day of, that's a sign that you're going too far and you're pushing it. If you're getting pain that's building, then you've probably pushed your tolerance levels too far. But before you get out into the trail and before you start pushing, you can do a lot of cross training back at home to try and strengthen up before you get onto the trail so that you have a greater tolerance level. And another thing with ACL injuries is they decrease a thing in your knee called proprioception. Proprioception is what we describe as joint position sense. So it's the ability of your body to know if your knee is bent or if your knee is straight, even if your eyes are shut and you can't see where your knee is. And that's crucial for things like balance. And when does balance become important? When you can't see your feet. So if you're walking around and hiking, looking at your feet, you've got bigger problems. But what I mean is you really need to build up this strength and this balance back in your knee. Otherwise, your foot and your knee isn't going to have the stability to support your body weight properly. If you have low proprioception, you'd be amazed how just simply walking with a weight on your back, the pressure going through your knee, instead of going in a straight and back direction, you're now getting a little bit of a twisting moment as well. And that's nothing to do with your knee being weak. That's nothing to do with the surgery going wrong. All that is your body hasn't learned how to balance properly again. And because you haven't got that balance properly yet, you're putting excess load through your knee that doesn't need to be there. So sometimes taking a step back and working on things like balance and control and strength through exercises such as Pilates or yoga is really beneficial so that you can get that whole picture of knee strength back again.
Yeah, fantastic. That's really, really good to know, because that's definitely something that I wasn't aware of. So I'm sure plenty of other people haven't been aware of. So that's a really, really good point to make. Oh, fantastic. Well, let's move on from ACLs now. If an injury does happen, like I'm with my clients and the people that I see week to week, I'm always try to get them as soon as they have an injury to see a physio as soon as possible. But I know the majority of people tend to wait and see if it gets better, and particularly in Australia, the whole she'll be right thing, instead of, just wait and see. And what's your opinion of early intervention from a physio? And then if someone did get into a clinic more or less straight away, what would be the types of things a physio could do to help aid recovery?
So I think the time to see a physio is if you've not if you've just walked around the street and the front of your knees are a little bit sore. That's an age-related thing. But if you're finding the same pain every time you're walking, or a pain that's increasing instead of sort of staying at sort of a baseline level, or you're getting clicking or crunching or giving way through your knee, or repeated issues, even things like repeated ankle sprains and repeated hip pinching, that will eventually cause a lot of knee instability. So I'd say any of those things. But the best thing about early physio intervention is we can work out exactly what's causing your issue by finding a diagnosis for it. So, for example, some people might have a meniscus tear, and sometimes that means we need to take time off. Take time off now means you can repair quicker and get back on the trail earlier. Or you might just have something simple like a patella maltracking problem, which means we can support that, we can strengthen the right muscles and get you back on the trail quicker. So although Australians have a bit of a she'll be right attitude, you can actually sort of shortcut a lot of your recovery time, even just by getting an opinion early on, and then you can get back into whatever you want to do a lot sooner rather than having to wait for months and months and months for things just to settle down on their own.
Yeah, beautiful. I think I might have to cut out that little section there and then just put it as a little voice message to a few clients. That's great. All right, so now we covered all my questions that I wanted to ask. Over the last week or so, I've been reaching out to a few clients and a few people in my audience for particular questions from them. So I've got 4 nice ones lined up for you. So to start with, this first one's from Roxanne, and she asked, how can I prevent general wear and tear of my knees from hiking?
Yeah, good question, Roxanne. When you say wear and tear, people usually refer to the cartilage in the knee. When the cartilage wears thin, that's the wear and tear, and that's when people get pain and stiffness and swelling in their knees. All of the research actually says that impact and exercise is crucial for cartilage development. So compression of any sort of a joint actually squishes the cartilage down, and when it releases nutrients with the cartilage. So I would say, firstly, preventing wear and tear, regular exercise that doesn't cause you any sort of knee pain. So find a level that suits you, anything from water aerobics for the really low level, or people trying to rehab, up to probably, running is great as well. Like, there's no evidence that running causes arthritis. So that's probably the upper level of keeping your knees moving and strong. But when it comes to actual hiking as well, the best way to prevent wear and tear is building up your strength and control. So things like your balance, things like that proprioception that we were talking about earlier. But almost most importantly is your quadricep strength. The stronger your quadriceps are, the less load that actually goes through your patella, because it can track more smoothly through the center. Strengthen up your hip muscles as well. If your hip muscles are strong, they stop your knees from pulling inwards, which stops you from getting uneven loading, especially through that medial meniscus or the medial cartilage, which is where most people develop osteoarthritis. So strong hip abductors, and also strengthen your ankles as well. So ankle strength, ankle balance is crucial for supporting the whole way up your limb, including through your knee joint.
All right, fantastic. Yeah, great. Hopefully that'll sort out Roxanne. Yeah, perfect. So moving on to the next one, we've got from Greg. He said, I blew out my knee the other week while I was hiking. What are the best exercises that will build back strength and stability safely, but as quickly as possible to get me back on the trail?
I would say, firstly, finding a good diagnosis. So when you say blow out the knee, it sounds like you've got a lot of swelling around the knee. Maybe I'm wrong. Swelling is the body's way of recovering or healing from an injury. If there is an injury or instability there, it needs to be diagnosed early so that we can work out if you need to rest earlier on or get back to exercise earlier on. And that really is the crucial step to recovery, because you don't want to get into something if you've got a big injury in there. But at the same time, you don't want to be doing nothing if nothing's happened, if you know what I mean, Rowan.
Yeah.
So I think a diagnosis is probably the most important thing to start with. And once you've got your diagnosis, you can go forwards from there.
Perfect. Good. All right. I'll pass that on to Greg. Next one is Amy. So Amy said she tore her ACL a few weeks ago. She was just concerned will she ever get back to full strength in her knees after surgery?
Yeah, so following surgery, they cut through the front of your knee. They graft some of your hamstring tendon usually, and then they bend that across a number of times to create your new ACL. So the ACL initially starts off weak because it's a tendon and it has to take time to get the blood supply back and turn into a ligament. So there is probably a period of 6 months where your knee will actually be a little bit weak, but that's only weak when you're playing sports where you're changing direction and twisting and turning, or jumping from a height and landing down below. So I would say your knee is going to be weak from that for the early stages. So I'd probably avoid doing any sort of bouldering style hikes earlier on. But later on, there's no reason why having an ACL reconstruction actually does anything to your strength. The issue is usually the rehab doesn't go properly. So if you don't have anything else compounding your knee injury, if it's just the ACL reconstruction, over time, as that heals and strengthens, you should be able to build up the muscles around your knee as well. And because none of the muscles have actually been affected, you can actually get them as strong as, or in some cases, this rehab goes so well that it's actually becomes stronger than the other knee. So I'd say long-term picture, there is no reason why you can't get back to full strength again, but just know your limitations in the first 6 months and build up slowly rather than suddenly.
Fantastic. And then I've got one more question from the audience, and this one is from Mary. So she said, everyone always talks about the ITB band when it comes to knees, but I have no idea what that actually is. What is it, and how does it affect my knee?
That's a good question. We haven't actually covered the ITB yet. I always laugh when people say the ITB band. It's like saying ATM machine. Because ITB stands for iliotibial band. And the band, if you've looked at it, it actually looks like a seatbelt. It's about the same width as a seatbelt, and it's actually probably a little bit thinner than a seatbelt. So it goes from just above your hip, it goes all the way down the outside of your quadriceps muscle, and attaches partly into your patella and partly into your upper shin. And what it is, it's a stabilizer. So I was talking about hip muscles before being important for having strong, supportive hips so that your knee can actually move in the direction that it's supposed to move. But the reason that iliotibial band kicks in is when you don't have that stability needed through the hip, it will tighten up to try and counteract or try and assist, I guess, making your knee more stable. So it has its function. If you're jumping off a ledge and landing on the ground, you need that ITB to kick in to stabilize your knee so that you don't get an injury. But when it's not working well, it's becoming fatigued and overused because it's only a very small muscle. It's probably about the size of two of your fingers put together compared to your glute muscle, which is about half the size of a basketball. Like, there's a stark difference. So when that glute muscle isn't working properly, that ITB gets so fatigued and so sore, all it does is it tightens up. It gets really, really tight, and it becomes like a band. It pulls that band so tight that your knee gets difficult to move. You might start getting some clicking or some pain on the outside of your knee there. So does that answer the question, Rowan?
Yeah, no, that's great. That's great. And I would say that's probably more than 99% of the people listening would ever have any idea about the ITB band. So that's really, really good to know. And I always find it's nice to, when people like to talk about particular things they've been diagnosed with or they might have heard on the internet, to actually understand what it actually is. So that's going to be really, really useful. So thank you for that.
No problem.
So I think that's about it for the questions. So the final thing I'd just like to ask you is just sort of, what practice do you hail from? If you were in the area, where can we find you? And just, a little bit about that.
Yeah, so I work in Ipswich in a city called Springfield. I work at a practice called Orion Family Physiotherapy, and we're a private practice that's all about empowering people to get out and live life again. We're a healthcare that cares. And we have a number of different staff who specialise from things from headaches and migraines to cancer, but also to things like sports rehab and getting back on your bike, getting back on the hiking trail as well. So that's what we're about.
Yeah, fantastic. Well, what I'll do with that is, if anyone is in the area, we'll figure out a little bit of a contact thing on the show notes, but that's perfect. But I think that's about it. Was there anything else you wanted to add to this, or anything you want to cover, or?
Not really anything more to add. I'd just like to end with saying, don't fear exercise. Don't fear wearing out your joints. Just take a step back. Look at your knees as having a certain level of tolerance. Some people have a low tolerance. Some people have a high tolerance. Exercise isn't the enemy. Too much of the wrong type of exercise is the enemy. So just find your level and just gradually build up over time, and you'll have healthy, strong knees.
Fantastic, mate. Well, thank you so much for coming on. I'm already know so many people are going to get a huge amount of value out of this, and it's going to be really, really brilliant for a lot of the hikers and trekkers listening. So, I really appreciate you taking the time to come on, mate.
Not a problem. Thanks for having me.
My pleasure. So there we go, guys. An absolutely brilliant episode today. I really do hope you got a whole bunch out of that. As I said before, if you do want to get your hands on that hiker's knee prevention program that Matt was mentioning earlier, you can download that in the show notes. Inside I'll have a bit of information about preventing hiker's knee, plus a free 12-week training program with video instructions included. So just go down below, download that. But I hope you enjoyed the episode, and we'll talk to you very, very soon. You've been listening to the Training for Trekking podcast. So if you've enjoyed this episode, please remember to subscribe, rate and review us in iTunes. So thanks for getting involved, and we'll see you on the next one.